Hello and welcome to the show. My name is Diana Varela, and today during the show we are going to walk you through the process of applying for disability benefits for children. We will get to show you all of the steps you have to take to complete the disability report. Social Security Administration provides benefits to children with disabilities. And the concept of disability for children is that the child has a medical condition. It can be a physical, mental, or emotional condition that results in severe limitations in functioning and development. And also that the condition is expected to last more than 12 months or result in death. And to apply for disability benefits for children, you need to call our toll-free number 1-800-772-1213. Our representatives will schedule an appointment. However, you are able to complete the online disability report. The disability report will capture the medical data that we need to make a decision. In order to do that, please visit ssa.gov. At the top of the home page, you will see benefits. And once you click on benefits, you will have a drop-down box that will open. And as you can see from the screen, on the upper right-hand side, you will see by type, you must select Supplemental Security Income. Supplemental Security Income is the program that allows Social Security to pay benefits to children with disabilities, as we spoke before in previous shows. Once you click on Supplemental Security Income and it opens the page, you need to know the application process is a three steps process. First, you have to complete the benefits applications. And as I said before, you have to give us a call at our toll-free number to schedule that appointment. Then you need to complete the disability report and sign consent for release of information. During this show, we are going to show you the process that it takes to complete the disability report. Once you click on Start an application, as you can see, it will show you Start the report. Once you click on Start the report, it will show you a page with information on the information that you need to gather before you start completing the report. Information about the child, such as Social Security number, name, address. We will also ask you medical history, education, and work activity. So please, before you start completing the report, gather that information so you can have everything ready and be able to answer the questions that we will ask you. First of all, we are going to ask you who is completing the report on behalf of the child. We assume that most parents will complete the disability report. However, a service provider, a family or friend can assist completing the report. We will ask personal information about the child, name, Social Security number, and date of birth, as you can see. When that application is completed, we are going to ask for more information so you can start completing the application and the disability report. In the first pages, you will receive a re-entry number. Please keep this page You can do a screenshot, or if you can print the page, because the re-entry number is going to be the key to complete that disability report in case you are unable to do that in one day. If you need to gather more information, specific information on doctors or treatment that the child is receiving, and you don't have it ready at the time you started completing the report, with the re-entry number, you can save whatever information you have included already in the disability report, and then gather the information needed and come back to the report later. So please keep that re-entry number. It is going to be the key to enter the report. We are going to ask you about the person completing that application. We want to know what is the relationship to the child. We will need to have an address, phone number, and if possible, an email address so we can communicate with you as the person completing the report on behalf of the child. We definitely need to ask information about the child. We would like to know not only the name and social and date of birth, but also if you are the person whom the child lives with. We need to ask you what are the illnesses the child is suffering. We will ask about treatments the child is receiving, and in the first pages we will ask the treatment, medical test, and also hospitals and doctors if the child has received this, because during the first questions that you answer, then the application will provide a path so you can provide further details and specific details about doctors, medical tests, treatments, and also medications. We will ask about the education as well. Is the child attending a school? Does the child receive any vocational rehabilitation? Is the child receiving any other services in the school, such as special education or any other type of support? And as you can see, we will require you complete and provide further information, the school name and also the address. It is very important that you provide us with the names of the teacher. We might contact teachers to ask for further details about the child's behavior in school. We will ask for the details about performance and also what is the accomplishments that the child is, despite the medical condition, is reaching. If the child is reaching the educational goals for the grade that the child is in. We will also ask for the medical history that includes the names of doctors, and be ready to provide a specific information, not just the name of the doctor, but also we would like to know what is the specialty. We need to know the address, exact address and phone number, and the reason why the child is seeing this particular doctor. We will ask also, and this is very important, to provide us with information on the periods that the applicant, the child, has been seeing these particular doctors. Also, when is the next appointment, and if possible, provide us with the chart or patient number. So that way, when we request medical records from this doctor or medical facility, we get the information that we need. We will also ask about any hospitalizations. Be ready to provide with the names of hospitals, address, phone number, and also, if possible, the days where the child was hospitalized. We will also ask for medications, the type of treatment that the child is receiving, and list all of them, and also who was the doctor who prescribed specific medications, and at the same time, the reason why the doctor has prescribed the medication. If there are any side effects, please be ready to provide and list all of the side effects for each of the medications that the child is taking. We will ask about medical tests. If there are several medical tests, please list all of them. And as you can see, we will not only request what type of medical test, but also where the test was done, who asked for the test, and if possible, be ready to provide any findings. So that way we can gather the medical information that we need to make a medical decisions. If besides doctors, clinics, and hospitals, that the child is receiving treatment for the medical condition, but there are additional sources, medical sources, such as if the child is experiencing depression or anxiety, and if the child has seen a mental health provider, please provide that information as well. It's very important for us to get the information on all the medical facilities, doctors, with the specific information on the course of treatment, as well as the address, phone number, when the child went to this medical facility for the first time, next appointment, and what is the treatment received at that specific facility. At the end, once you complete all of these questions, you will have the chance to review and send the disability report to us. As you can see from the column towards the left, you will be able to edit, just review and edit, change any information if you have to do so. If you have further information, you can add, you can change. In that way, you will be able to take a look at the medical data. At the end of the disability report, you will have the chance to add remarks. Please make sure that you utilize that section of remarks to provide us with information that is how your child is being impacted by the medical condition that your child is suffering from. For example, in this case, we have a child that is suffering from leukemia, and let us know in regards to the symptoms, the signs that your child is experiencing. In this case, the child is really sick very often, unable to go to school. He is in pain. The child is constantly getting infections and hospitalized due to chemotherapy that depresses the immune system. All of that information is going to be used to make a medical decision. And the more detailed and complete information that you provide, it will take us less time to make a medical decision, and the outcome of the decision will be what you are expecting. Once you send us the application, you can print a medical release, and that will allow Social Security Administration to gather all the medical evidence from the providers that were listed in the disability report. As you can see, completing a disability report when applying for benefits for children with disabilities, it is a process that is simple. You just have to answer questions and go to the next questions and be ready from the very beginning to get and gather the information that will allow you to complete a disability report. That is the information that we will use. Stay tuned for further information to this show. We will continue providing with information, so if you have to apply for disability benefits for your child, you will be ready and we will be able to assist you and your family during this time. Remember, you still have to give us a call at 1-800-772-1213 to schedule your appointment. Thank you for watching.